17 months. We're joined by ABC7 News special correspondent and pediatrician at Stanford, Dr. Alok Patel. Thank you for being with me this afternoon.
Important town hall. Thank you for hosting it.
So there's a lot, Dr. Patel, to discuss with our live panel today. So we're joined by Christine Garcia, a psychologist and regional director at the Edgewood Center for Children and Families. Dawn Kamalanathan, the Chief Facilities Officer for San Francisco Unified School District, and Olivia Udovic, a teacher in the Oakland Unified School District. Now, before we get to you, today we will also be sharing messages from some local Bay Area students. We reached out to families on social media to share their thoughts about back to school, and this is the Hull family.
Hi, my name is Kirsten and I am in 6th grade. I love being at my new middle school. My favorite part of being back at school is that it's a whole day and I'm able to see my friends a lot more than I was last year. Hi, my name is Reagan, and I was so excited to go to kindergarten, and I really wanted to meet new friends. Hi, my name is Brendan, and I'm super excited about being back in school. I really am excited to have a full day, but I'm really not excited that we have to wear masks.
Nice. Okay, let's get to it. We want to begin the conversation with our panel, and I'll start, please, with Dawn. Dawn, I know that you have one of the most challenging jobs in the San Francisco Unified School District. In a few seconds, if you will, how did you transform classrooms and schools? What did you do?
You know, I think it started with, we actually, I think, took an initial approach to go slow to go fast. So we spent time to really work with our partners at Department of Public Health, which I'm very grateful for that partnership, to really map out on a classroom by classroom and school site by school site basis the work that needed to be done. And then once we were able to transform what we understood based on medical science into very specific but clear and simple directives about how to set up a classroom. And then we basically broke it down into pieces, into a spec, and identified many interdisciplinary, we have an interdisciplinary team at the SFUC Facilities Division, and then broke it down into tasks for each of the teams to handle, and tried our best to really turn it into a checklist that could be deployed evenly and consistently across 3,000 classrooms. And I'm very happy and proud of the work of that team, that we were able to do that successfully and open schools for in-person learning on August 16th.
And of course, we had to have the approval of the San Francisco Health Department as well.
That is correct.
Okay, Olivia, I want to go back to you. Now, you're from Oakland, and let's remind everyone that you are a kindergarten teacher. So many, all of your students are not vaccinated. None of them are. And so you've been in the classroom for 2 weeks. So tell us a little bit about that. What challenges have you seen, dealt with? How are you dealing with issues that might appear in the classroom? What has worked? What hasn't worked?
Well, to start with, it's just been an absolute delight to be back in the classroom. It's the joy of it's why I do the work I do, is to be around young children, and they are all so happy to be in school, and we're having a lot of fun. The masks, it's an annoyance, but they're doing a great job keeping them on, and engaging with all the in-classroom activities that unfortunately were not accessible last year for very good reason. But my concern is that we continue to be able to offer this in-person option. We have already had 3 cases of students testing positive at my site. So that is stressful for the teachers, for the parents, for the students to be in that situation. So just trying to, I'd like to see more testing, being made available so that we can catch cases before there's any spread within our classrooms, and our schools can stay open.
And I want to ask Dr. Patel, I hear districts talking about this constantly. They say in the majority of cases, kids are getting COVID outside of the school, in the community. So as a parent, how is that supposed to make me feel, let's say, a little bit more confident about sending my kid to school?
Well, first and foremost, I have to say, for people watching those testimonials of the kids making the videos, kids seem more optimistic and logical than adults do nowadays. So I'm so happy to hear kids in their enthusiasm about getting back to in-person learning. Now, Leanne, talking about community spread, yes, contact tracing is extremely important as we reopen schools, because when we see those outbreaks in the classroom, it's really important we find out where they came from. And that not only helps with quarantine and isolation, but it helps with prevention. Now, for parents who are sending their kids back to school, especially all those parents of children under the age of 12 who are not able to get vaccinated, it's really important that everyone around you is vaccinated, but that you're also doing what you can to keep your child protected right now. We know that the Delta variant is way more contagious, and it's never too early to teach kids really important things, not only safely and appropriately wearing a mask, but also basic hand hygiene, things we've been talking about for more than a year and a half now that are important basically always when it comes to fighting off respiratory infections. And these kind of habits, if parents model them, if parents help empower children, we have seen time and time again, children do very well when they're kind of outfit with this empowerment. They know that they're not only keeping themselves safe, but they're protecting everyone around them. And I think everyone on the panel can agree with that. Empower kids, and they do amazing things.
Now, I want to ask Christine, you know, when I hear that someone I know has tested positive for COVID, I feel anxious. So I can't imagine how kids who are entering the classroom must feel. There must be some anxiety. So as a parent, what do I tell my child? Do I tell them, be safe? Be careful, wash your hands. What message do you want to tell parents?
I think all of those things are really important. And we have to remember that COVID has been with us for a while now. Kids have actually been living with COVID for a while, just like all of us have. And so I think what Dr. Patel mentions about making it part of the family, part of routine, you talk about safety, putting on a mask, you know, if you're able to get vaccinated and able to maintain all sorts of different protocols, then I would suggest doing everything you can and modeling for your kids what is important about mask wearing. It's just like brushing your teeth. And kids will take to that very well. And then if they hear that some of their friends are sick, I think follow the science, talk to them and let them know that, you know, a lot of the science out there is saying that there's also, you know, mild cases of COVID, and that they just have to make sure it's our responsibility all together to keep our community safe, to keep friends safe. And that's why we're doing all of these different steps, and schools are doing all of these different steps with staggered schedules, some of them in different ways to mitigate the spread of COVID. So I think reassuring the kids and letting them know there are things you can do to keep safe and keep your friends safe.
And sometimes I think they do better than we do.
They
Olivia,
do
let me
wonderfully.
ask you. Right, and Olivia, let me ask you, how are you approaching your students? What are you telling them? There's so little.
A lot of what Christine just shared. I think it's a great opportunity to really model and discuss empathy and discuss caring for others. And just what we do to take care, what we all have to do to take care of each other. And that has been said, that's a really easy lesson thing for children to understand. And it is a great moment for teachers. Also, I think it's really taught me, reminded me, and as a longtime educator, to the importance of slowing down and taking the time to wash hands, have everyone wash their hands before going to lunch, to taking the time to do all the social emotional learning that kids always need. But this year really the last year has really, for most of my colleagues, has been a good reminder for us to slow down and take the time for that the benefits of that are countless. And so I think that's what we've been doing at our school, is just trying to take it slow, trying to make sure that all of our kids are feeling loved and seen and experiencing joy in their classrooms, so that they, and feeling safe, most important.
And you haven't had any cases in your classroom?
I have not had any in my classroom. There has been 3 at my school site, but not in my particular classroom. So I haven't had to deal with that challenge. But we do have many families also at our school who've experienced a tremendous amount of loss over the last year, either in financial hardship or loss, death in families, or illness in extended families, and that's something that we also have to be aware of. And for our newer students that are coming in, there are things that we might not even know that they've experienced. Our families that have been part of our school community over the last year, during the pandemic, we have really worked together to make sure that we were supporting them as much as possible. And now which is very hopeful, because now as the kids re-enter, we know which kids might need a little even more social emotional support because they've dealt with additional hardships that wouldn't have happened if this pandemic hadn't.
And we're so glad you're there. Thank you for that. We have much more still ahead here on ABC7. And if you're joining us on Facebook Live, stay with us, because we'll be continuing this conversation there during the break. And we want you to join in the conversation. Of course, you are part of this ABC7 town hall as well. Go to Facebook or YouTube to weigh in and interact in today's virtual town hall. And now, a message from Emma Alvarado, who is in the 2nd grade.
I like to be outside for school so we can have some fresh air. Quarantine is driving me crazy because we can barely do anything in the house. We can finally see our friends and teachers again and have some fun with them and play.
So we're continuing our conversation, and I want to ask Dr. Patel, youth sports. A lot of concern, parents who think that it is safe, others don't think so. What does the science tell us?
Well, the science is broad here because it really does depend on the type of sport. And obviously, some sports are played outdoors, some are played indoors. Some sports have heavy contact, some don't at all. And so there is going to be a difference there. And I understand why parents are concerned. I also understand why it's important to do what we can to support youth sports, because it's really important for kids mentally and physically to be back out there and playing the sports they love. Now, one thing that we've seen from contact tracing, so that is looking at positive cases associated with sports and then going backwards and saying, where did that potentially spread? Where were people getting infected? Oftentimes it's from bus rides, it's from the locker room. One case report was from a pizza party that happened after the sport was played. And so, that's why it's important to kind of isolate these cases and say, okay, if we had a dozen members of a football team test positive, we can't simply say it's because of the sport itself. We have to look back on that and say, at what point of contact could team members have exposed one another? And so that's why, it is really incumbent on parents and youth athletes, coaches, everyone out there to make sure that their athletes are practicing all those safe hygiene techniques and doing everything they can, not only on the sports field or in the swimming pool or the basketball court or the tennis court, but everywhere that's surrounding it.
Yeah. And Dr. Patel, a lot of parents, believe it or not, still asking at this point, is it really safe to be in school?
And that is a very important question that has to really come down to your individual risk. And is your child high risk? Do you live in a place where multiple people are unvaccinated? What does community transmission look like? What do vaccination rates look like in your community, in your school district, etc.? And I understand why certain parents in districts where there may not be a lot of masking feel that trepidation. And we've already seen multiple parents pull their kids out of school. But what we can say, based on the data we know, is that if your school is led by some of these all-stars on this panel who are following the safety precautions, vaccination rates are high enough among those who are eligible, your children are relatively safe. But there is an asterisk there, and that's why it's important for parents or anyone concerned to talk to the school, talk to people in charge, and look to see what safety measures are in place.
That's right. The communication is so important.
Really is.
Christine, I want to ask you in terms of, kids are so resilient, but the reality is they spend 17 months away from interacting with other students. And so what the effects we know were depression, again, anxiety. They're coming back into a classroom, into a world that they didn't really know or remember that all that well. So what advice do you have for parents?
how to get them.
How do they
you mean
approach the
how to-
subject? Yes. How do every morning do you know? How do I approach the subject with my children? How are you feeling today? Might be a good question.
It depends. It depends how old the kid is, and it depends. You know, there are different ways to ask that question, but definitely that is the core of what you want to know is how they're doing, 15. Right? And I would say to keep a close watch, don't hover too much, especially if they're teenagers, and also keep your ear out for different things that they're saying.
The best thing about being back at school is seeing my friends, seeing my teacher, and I just love being back at school.
Best thing about being back in school all day in person is seeing my friends, seeing my teacher, no Chromebook, and being on campus all day. I love being back at school.
I like being back in school because it gives me the chance to socialize and see my friends after over a year of not being able to see anybody at school.
Okay, that was Hudson and Emerson Wright and Alexa Elzy sharing their thoughts on back to school. Now let's get back to our panelists. Dawn, I want to approach the subject that so many parents have asked me about, ventilation. So I read one of your tweets and you said the district counted and checked more than 70,000 windows that open. 70,000 windows.
Yeah.
So you have filtration systems, some, again, the windows and portable air cleaners. You don't have all three. And I guess the question that a lot of parents are asking, you know, we have these fires up north. What are we going to do when that heavy smoke reaches us? It's already reaching us, San Francisco Bay Area. But what are we going to do when we have to close those windows and we don't have those portable air filtration systems?
Yeah, absolutely. And it's a great question, and it's a totally fair question. I think we were so effective this past spring and really messaging to families around what the basics of a layered COVID prevention strategy are, right? And of course, the core of that is vaccination and wearing masks indoors. And that is something we didn't have in spring. And then also layering on top of that, ventilation measures, hand washing, hygiene, and, you know, I think basic common sense. Let's not forget that, let that go either. And as folks have internalized that messaging so deeply, it's very natural for them to be concerned that as we have wildfire smoke, and if should it be as intense as we experienced, you know, last year and 2 years before that, what should we do now? And we have spoken again in a lot of detail and frequency with our partners of the Department of Public Health. And because we have vaccines and masking indoors now, that does allow us, we can continue to have school, even if we have to close windows. So I think that's important for folks to understand, is that our most important core strategies right now are vaccination and masking indoors. And these other strategies all come in to support and enhance the effectiveness of those core measures. That being said, we have purchased portable air cleaners as part of our COVID prevention strategy for certain locations within the district. And we fully intend to continue to purchase portable air cleaners. So we are lucky right now that as we look at our various air quality forecasts, that we've been in yellow and we're going to hopefully have a good weekend. But I understand that those circumstances can change very quickly, and just encourage folks to stay abreast with the school district and with their principals about what makes the most sense for their sites.
So before I go to Dr. Patel, let me just ask you this, because it's a pressing question. I think you have about 775 of these units. Clearly not enough. You have 117 schools in San Francisco. So when are we going to meet that need? When are you getting more? And is it an electrical issue?
You know, we were concerned that there are certain buildings which are very old, right, and have not recently, we're an old school district. We do have buildings that are much older. We have, over the past summer, spent a lot more time in our individual buildings and understanding what the different challenges are associated with them. So I do feel confident that there is a strategy for how we can move forward. And part of what we've been doing with those 775 portable air cleaners is testing out site conditions and seeing, do these make a lot of noise? What's the power draw? Are they being effective? Are they reliable? And we feel like we've identified a set of tools now that are going to work for us in our buildings. So the question really is just how to go to scale with that. And I think parents can expect to see more news and from the district over the next few weeks as we both iron out just kind of funding and timing and deployment. So we do have a plan for how we'd like to move forward. And I think just as we took incremental steps to get there for spring, we are also going to be moving in batches of schools as we move forward to deal with this issue as well.
So, Dr. Patel, if you had the choice, smoky air, this is very important for parents to understand, smoky air or risk getting COVID because you're inside a room with the windows closed.
Oh my gosh, that is a rock between two very respiratorily driven hard places. I may have made that adjective up. And so, again, this goes back to what the actual situation is like, and which is why we can make guidelines. But if you're saying we have smoky air, what exactly does the AQI, the air quality index, look like? Because that might not be even acceptable for a child with certain underlying cardio or pulmonary issues. A kid with heart disease or a kid with asthma may not be able to tolerate that at all. And so that's definitely a huge point of consideration. But at the same time, if you're in a district with a lower vaccination rate and high community spread, being in that classroom might also be a risk. And this is where it comes down to parents trying to look at their own level of comfort. And the two quick points I wanted to add is ventilation cannot be emphasized enough in terms of how critically important it is in keeping our kids, keeping all of us safe. I feel like we spend a lot of time rightfully talking about masks, but also things like plastic dividers, hand washing, and personal hygiene. But ventilation is so incredibly important. People have been asking me, are there ways that we can ensure that schools are providing an outdoor option for kids who are eating, a time when kids might be closer together or taking their masks off? And one question I wanted to pose to the panelists, if, let's say, fire season, knock on wood, let's say it's really bad and the air quality index is high, and all of a sudden some lower income school districts without funding are like, what do we do? Is it possible to crowdsource from the community or from parents to get a portable air filter in those classrooms so we can keep our kids safe and in person?
Okay, let's answer that in just a second. We have much more still ahead here on ABC7. And if you're joining us on Facebook Live, stay with us because we'll be continuing this conversation there during the break, and we want you to join in that conversation. You are part of this ABC7 Town Hall as well. Go to Facebook or YouTube to weigh in and interact in today's virtual town hall. But first, let's hear from Destiny and Isabella sharing their thoughts about back to school.
Are you happy you went back to school?
Yeah.
Why?
It's because I like to make new friends and talk to them and play with them at the park. I like that. Yay! I really like doing ballet and I really like going to school, but ballet school is my favorite, so I want to show you some moves.
Cute. So, Dr. Patel, your question for the panelists, and I'm actually thinking, do parents keep their kids at home when they have to make that decision between, smoky conditions and COVID?
I wouldn't be surprised if certain parents did. And I think that's an unfortunate reality of what we're going to run into as we approach fire season out here in California. I think it's something to also consider. If schools do have those portable air filters and if kids are wearing masks, that's a different situation. And parents can feel a little safer with kids going back to in-person learning, especially if those, if windows are down but there's good air circulation from a filter. It's something to really consider. But honestly, if we get a situation where schools are are stuck and some schools are like, hey, we don't have portable air filters, I'll buy one. I'm sure people in the community would step up just to make sure we're protecting our kids.
Dr. Patel, you had a question for the panelists as well.
I was just asking if parents were willing to kind of help out with the schools. I know it's terrible to have to ask, hey, our school system is already not funded well enough as it should be, but is there any thought about that? Have parents volunteered to step up and say, hey, we will help with portable air filters? I only ask this question because there are articles written about this across the country, and I've seen examples of certain parents donating air filters for their children's schools. Have any of you run into this yet?
Yeah, I think it's actually a really common question for us, and has been actually throughout the shelter in place period of the pandemic. And as we prepare for even in-person learning this past spring, philanthropy has been an important partner, certainly for San Francisco Unified, and I think many other school districts as well. And so I think that the important thing is that that philanthropy, whether it happens at kind of a large systemic level from larger philanthropic partners, or even at the individual PTA level, that again, folks work in concert with the district. Because I think the thing that is challenging is that you can go to your own local hardware store and pick up a portable air filter that feels affordable to you, maybe as a PTA, but actually doesn't have the power and capacity to provide adequate filtration under classroom conditions. And so that's something that I just want to caution folks about, is that and we're working as well to provide more clarity to our partners about how they can support us in reaching these ventilation goals, both in the short term around portable air cleaners. But I think it's really important, and something we've talked about with the Department of Public Health as well, that long term, we need different strategies, that climate change and wildfire season is here to stay, and that the best thing we need to do is also long term and on a systematic, regular basis, continue to invest in our facilities to make sure that we're prepared for these changing conditions.
So Dawn, could I ask you quickly, lunches are taken outside at some schools for obvious reasons, right? What do you do in the case when it's too smoky? And maybe we can address that on TV, but the question is, again, will the district consider maybe sending students back to, home after that? So let's address that in just a minute.
Hi, my name's Melanie. I go to Terra Hill School, and what I do like about being back at school is seeing all my friends and having fun, and I like my teacher.
I like in-person learning because I get to see new friends and I get to see old friends, and I like homeschool because it's easier to do, and you don't have to worry about getting COVID, and you don't have to wear a face mask, and you don't need to wear a uniform because no one's gonna see you.
I love how
these
candid
kids are awesome.
I know, they are so candid. That was Melanie and Kanoa sharing their thoughts. Thank you. On back to school. Now let's get back to our panelists. We were asking during the break, asking Dawn about taking lunch outside because of COVID. It's safer that way. But what happens when you have the really smoky day? Where do you put them? Do you put them in the gym, or will the district consider sending kids home at some point?
Well, I think one thing I want to highlight for folks is that over the past, particularly two especially bad years of wildfires that we've experienced, we've actually only closed school for one day, and that was when we were in Maroon. I think the first year of the really bad fires. Before we shut down schools, we have protocols in place, again, to gradually escalate the types of interventions that are needed associated with AQI. And so first we start with bringing kids inside, having fewer outdoor activities, because the most important thing is, as we've learned over the past years, we spent a lot of time and energy and a lot of families trying to get their kids back into school for in-person learning. So we take that decision very seriously, and really try to take all options we can to keep school open for in-person learning. The thing is too also that our schools do have cafeterias, and the volume of air in a cafeteria is not that dissimilar from a gymnasium, and certainly many sites like elementary schools don't even have full-size gymnasiums. So we have encouraged people to be outdoors as much as possible. and as much as makes sense for their particular school site. But actually at SFUSD, all of our cafeterias, we have equipped them with large scale portable air cleaners. So we have taken that step within cafeterias, recognizing the fact that kids have their masks off, that they're talking, that they might be closer to each other, and encourage folks when, if there are windows or also doors, that when the air quality is good to open those. So I think we have plenty of options for ways to keep kids in school as much as possible. And that in terms of wildfire smoke AQI, again, the important thing is first go indoors, that in and of itself provides a fair amount of protection. And again, in working with DPH, that we can operate, again, classroom conditions in school transmission is very low. And that is part because we also are able to maintain a fairly controlled environment. So we are going to do our best to, again, respond to the conditions in partnership with Department of Public Health. And I do think that the choice is not as binary as either being able to go outside for lunch or not being able to have school. There is a whole range of interventions and options before we get to that point. And as we move over the next few days and over the next few weeks, we have gradually been increasing and again, layering on strategy after strategy with different investments and interventions. And we're going to continue to do that. Okay, let me ask Olivia, a day in the life of a teacher, let's say a child suddenly at 11 o'clock in the morning has a runny nose, starts sneezing. You don't know, you're not an expert, you don't know if it's allergies, if it's smoke related, or if it's COVID. So what is the protocol at your school, at the district?
So in Oakland, for Oakland Unified, the protocol is that child is immediately, kindly, we're having somebody removed from the classroom, taken to our wellness space, and they will be given a rapid test. And they are sent home and they can't return until they've had a PCR negative test results. Just to return to what was being spoken about earlier, I feel very blessed that and grateful to my union here, the Teachers Union in Oakland, because we do have HEPA filters in all of our classrooms, which was a huge, one of the key things that teachers were not willing to come back into the classrooms until that happened. Unfortunately, these machines are very expensive. I have two, I need two in my classroom. There's two in all the classrooms at my school, and they cost over $400 each. So this is not something that at most schools that parents could fundraise for. Certainly not at the school that I work at or the school that my children attend. And I think that with all the money that school districts have received, Oakland Unified has gotten $300 million in COVID funds already, and we'll be getting more. And I'm sure other barrier districts are getting comparable amounts.
Let me quickly ask Dr. Patel, because I want to ask him regarding, just putting the teachers in an awkward position in terms of knowing, what does the child have? So what advice do you have, doctor? Is there a way to tell?
It's difficult, and teachers are rock stars in what they have been through and their patience and resilience throughout the pandemic. And I agree that the most important thing to do is say, hey, this child is symptomatic, let's sort it out, let's get a negative test. But one of the really quick things that we can use to differentiate between wildfire smoke exposure versus a respiratory illness like COVID-19 is the acute onset, how quickly a child develops symptoms. Now, if we open a window and the AQI is really bad and all of a sudden children are saying, hey, my eyes burn, or my chest feels tight, it's hard breathing, there's a little bit of a correlation there. Because remember, the wildfire smoke, you've got these really tiny particles, really small, smaller than a strand of human hair. They can get inside your nasal passages down to your lungs, cause some irritation. That's going to be different than a child who may have had a little bit longer symptom course. And also things like fever, body aches, runny nose, especially a loss of taste or smell, is more likely COVID-19. I shouldn't say more likely. You're not going to get a loss of taste or smell over a long course of time from wildfire smoke exposure. The last point I want to make really quickly, and kind of addressing what was said about the layers of mitigation, I don't think it's fair to say that, hey, if the smoke is bad outside and we have to shut windows, do we need to shut schools down? Because I absolutely agree that there are important layers of mitigation. We can't make that rule either, because there's a lot of schools out there that don't have ventilation. Not every classroom may have a window, but we know that there's a way to keep those kids safe and still in the classroom.
Great. We still have some final thoughts on back to school coming up on ABC7 News at 4. And if you're joining us on Facebook Live, stay with us because we'll be continuing this conversation there during the break. But first, students Ella and Athena share what they think about heading back to the classroom.
My thoughts about going back to school is that I kind of get scared sometimes because there are a lot of COVID cases rising ever since back to school happened. And I just don't really feel safe about it, but yeah, school's kind of fun, but I just get kind of scared sometimes.
Hi, my name is Athena. I like going to school because I get to see my friends, but I don't like going to school because I have to wear a mask.
So we're continuing our conversation. So you were mentioning, Olivia, PCR test. The results take a few days. When that happens, what do you do? Do you send the children home with homework? How do you continue the conversation and continue interacting with that student who's now at home and not in the classroom?
That's a really good question. Unfortunately, there hasn't been much direction yet as to what we should be doing for that. And for our younger students, my kindergarten students, we're right now trying to make sure that all students have technology at home so that we can put into use some of the resources that we developed and learned about last year. But unfortunately, they don't necessarily have that technology like our older students do. And I think at this point, unfortunately, teachers don't necessarily have the capacity to be providing strong distance learning options to the students and teaching in person at the same time. And I think one problem that we're seeing in Oakland, there's a long wait list to get into the distance learning program that is being offered. And a lot of families wishing they could take that option and feeling like they can't because they are afraid to lose their spot at their school or are afraid that they're just going to be waiting on a wait list all year. So I'd love for our district and districts across the Bay Area to develop ways that we could offer distance learning programs from their school site so that they could really get a quality program like many students received last year for those families that want that option because it is a choice that many families feel like is better for their situation.
And I want to ask Christine about that because I don't have data right now, but studies have indicated that, communities of color seem to be the ones who want to do more distance learning and keep their kids safely at home. And why is that? Is there a trust factor here?
Well, I don't have hard data on it, but anecdotally, yes, there's a lot of fears. A lot of those communities, without making too many generalizations, the vaccine rate in some communities of color are lower. And there is a general kind of trust issue that can occur between families and schools. There's also a lot of multi-generations living in one space that can make sending your kids to school a bit scarier because of possible exposure being brought back from kids going to school. So some of those are some of the factors that impact communities of color feeling comfortable sending their kids back to school.
Dr. Patel, is it time for weekly testing at schools?
I think it's time to definitely start talking about weekly testing, screening testing for those who are unvaccinated, just to try to stay on top of any potential cases. There are thousands of kids across the country who are being quarantined right now because of outbreaks. We can do what we can to prevent those.
8, 7, 6.
Great. Okay. We want to continue the conversation in just a second. So again, we want to thank our panel of experts for taking the time out of their busy schedules and to talk to all of us. And it's very interesting because if I can now just ask quickly some of you to talk about what you want to convey, the message to either teachers, staff. So let's keep it really short. What do you want to tell parents and teachers? Any of you?
I'd just really like to see parents, really advocating for what their school sites need. Here in Oakland, we need weekly testing. We need it 2 weeks ago. And so there's petitions for that. There's a school board meeting next Wednesday. Please come support our school board director Hutchinson's resolution to get weekly testing mandated here in Oakland for all of our students so that we can keep our schools open, so that we can keep our kids safe, and so that we don't have to go back and forth between being quarantined and not quarantined. We can catch cases before they spread between children. So just for parents to advocate for the safety measures their students deserve.
Olivia, great conversation, and thank you to all of you, and of course, Dr. Patel. Such a great conversation. Now, thank you for joining us for this special edition at ABC7 News at 4 o'clock. If you missed some of today's conversation, you could, of course, watch us again on our connected TV apps on Roku, Apple TV, Fire TV, and Android TV. That's a lot of stuff. We also have a series of stories our reporters have done throughout the week on back-to-school topics. Search ABC7 News Bay Area to download the app. Again, thank you for joining us. And now ABC7 News at 5 is coming up next.